Hello and welcome to the Wellbeing Show. This is Reshmi, your host. Today's episode is going to focus on a medical condition caused by menopause known as sarcopenia. It mainly affects the muscles. To discuss this in details, I would like to invite my friend Dr. Maureen Tigga. Dr. Tigga is a member of the Menopause Society in India, and she has been a part of our previous episodes where we have discussed other menopause caused medical conditions. If you have not watched those episodes, please do that. And without further ado, let me start today's episode with my very first question. So, Dr. Tigga, in layman language, how do we understand what is sarcopenia?
Well, thank you, Reshmi, for yet another opportunity to share my insights on this very important topic, sarcopenia, and a hello to the lovely audience. So, in a layman language, sarcopenia, the word sarcopenia has two parts. One is sarco, which means muscle, and penia means deficiency. So, when there is deficiency of your muscle fibers, or in simple terms, when you lose your muscles, it is termed as sarcopenia. And sarcopenia is a skeletal muscle disorders which will have these three components. There will be a loss of muscle mass, there will be loss of muscle strength, and there will be loss of functionality. So all these three components will get hampered. And having said that, the good news is that if you are able to diagnose this condition early, if you are able to screen it early, the outcomes have been very favorable and it has been good. So that is why we are taking up this topic today. And that being said, I would just like to take our audience through the different stages of sarcopenia. The first one is the probable sarcopenia, or where there is just the muscle mass is lost, but the function and the strength of the muscle is intact. There is no loss of these two. Then the second one is the proper sarcopenia, where there is a loss in the muscle mass, the functionality, as well as the strength. And the third is the extreme category, where there is severe sarcopenia, where there is significant loss of the muscle mass, the strength, and the functionality. So this is all about, in a nutshell, what sarcopenia means to a layman person.
Okay, all right. So now, what are the signs and symptoms of sarcopenia?
So there would be certain alarming signs, seeing which you can suspect that there could be sarcopenia in a person. And that is, first one is unintentional weight loss of more than 5% in a month. Second is midlife obesity. What happens is that when you are losing your muscle mass, those muscle fibers are replaced by the fat cells. So paradoxically, the patient will gain the muscle mass will go, but the fat cells will increase. You may look like an apple-shaped person who is plump, but the actual reality is that that is all fat and the muscle mass is gone. And in this situation, your insulin resistance increases, and that makes you more prone to diabetes. So this is the second alarming situation, where you can see that there is a midlife increase in obesity. Then there is slow walking pace, that is less than zero point 0.8 meters per second. If there are devices by which you can assess this. Then there is inability to stand from a chair. Like if you're sitting in a chair and you are not able to stand, then you should suspect that are my muscles giving way. And then there is history of frequent falls and loss of balance because your calf muscles lose their function. The other thing is that you start feeling weak. Simple things like carrying out your daily chores, like carrying a basket of groceries, becomes difficult. So these are the signs by which one can suspect that there could be probable sarcopenia.
Right, right. So, are there any diagnosis and tests available to find out?
Yes, so there are certain screening methods and tests by which you can diagnose sarcopenia. So the screening method is that there is something called SARC-F questions. These questionnaire is self-administered, they are non-invasive, and if you answer these 5 set of questions, a score of total 10 is given. A score of 2 is given for every question, that is 5 questions. So what are those questions? First one is to assess your muscle strength. That is, do you have difficulty in carrying, say, a 5 pound grocery box or a five pound weight? Then the second question is, are you able to walk midway through your room? Then the third is, are you able to climb 10 steps without any support? Are you that is, assistance in walking is assessed. Then Fourth one is rising from the chair. That is, are you able to stand up from a seated position without the help of anyone? And the last question is the number of falls you had and the frequency, how many times you were out of balance and how many times you fell. So in this scoring system, if your score is 0 to 3, then you are a healthy person. But if the score exceeds 4, then you are suspecting that there is a possibility of suffering from sarcopenia. Now, that being said, what about the diagnostic tests? So, physical examination, by physical examination, you can measure your calf circumference. So, in a normal woman, it should be more than 33 centimeter, and in a man, it should be more than 34 centimeter. If it falls below this, then you are losing your muscle mass, and you should get yourself evaluated. There are certain tests that is known as the balance test, the gait test. Sometimes another type of test is your chair standing test, which will assess how your muscles are functioning. Also, adjunct tests are available like creatinine kinase levels, which will tell that your body is losing the muscle fibers, or CRP, that is C-reactive proteins, which may tell that if the body is having chronic inflammation. And also there are tests like you can go for an ultrasound to actually measure the bulk of the muscles which you have, and that can help you to find out whether you are suffering from sarcopenia. In the last talk, we talked about the DEXA scan, which told you about the bone density. So in that test, that also helps to corroborate your findings whether you have sarcopenia or not. So these are a battery of tests, and there is another test which is done, that is the hand grip test, and there are different cutoffs which will tell you whether your muscle is performing that same strength and that same power is experienced by the it's demonstrated by your muscles. So these are just a few tests through which we can find out that whether sarcopenia is present or not.
Very, very useful information, really. But I'm confused about something. So, as a woman, how can I differentiate between menopause caused sarcopenia and if I'm having general muscle pain or muscle anything like anything in my muscles is not right. So, is it different?
Yes. See, muscle pain is the term which we use for muscle pain is arthralgia. And I think we can talk about it in the upcoming episodes. That is another topic on its own. And sarcopenia is that actual bulk of the muscle is being lost. So as I said, that how we assess physically, we assess it by measuring the calf circumference. So if it is less than 33, you are suspecting that you have lost the muscles. Having said that, I would also like to tell that there are different types of sarcopenia. One is menopause associated, one is age associated, and the third one is lifestyle associated. So, in menopause associated, it will occur after menopause, and it will be due to the deficiency of your estrogen. And there will be accelerated loss of your collagen fibers, and that will also lead to your muscle loss. Then, age related is something which is inevitable. I would just like to share with our audience that once you reach the age of 35, regardless of your gender, whether you are a male or a female, your body starts losing some amount of muscle in form of you can say around 0.8% per year. And the same rate of loss is hyper accelerated when you reach the age of 60. This is not nowhere related to whether you are a woman or a man. This happens to all human beings. And once you are 60 touching 60, almost there is an 40% loss in your muscle mass. So this is a part of the general aging process. Then the third category is your lifestyle associated sarcopenia, where you are losing muscles because of certain practices or your lifestyle, you can say behavioral pattern. So if you are sedentary, if you are not exercising, your muscles go into something known as disuse atrophy, and your muscle weans off. Then if you are not taking proper diet, if you're taking too much of carbohydrates and not supplementing yourself with proteins, because proteins are the building block for your muscle, so that can also lead to sarcopenia. One important thing which I want to share here is that sometimes when you do crash dieting or you are severely ill, then also you lose your muscle mass very in a very fast pace. So for example, it has been seen in various studies that if you are bedridden for say 1 week, you lose up to 3% of your muscle mass, and that is equivalent to losing the muscle mass in a gradual over the next 4 years. So what you would lose in the next 4 years if you are bedridden for say 1 week, you lose it in that 1 week period. And that is why we tell that our patients who are bedridden, that please do leg movements even when you are restricted to your bed. That is only to tell that your muscles should keep working and you do not lose it. So these are the different types of sarcopenia, and it is definitely different from just a simple muscle pain. You are losing the bulk, the actual cells of your muscle in sarcopenia.
Wow, very wonderfully explained. So, is it actually possible to reverse sarcopenia? Can you get back to your healthy muscle stage?
Oh, yes, I like this part of the conversation because we have just talked all the extreme that this happens, that happens. The good news is, yes, we can reverse sarcopenia. And even the better news is that it can even happen in extreme of ages, like even if you're 50 or 60. So please don't give up, please don't lose hope. And the best, the key, the golden thing which we are here to promote is that the best thing which you can do for your muscle is resistance training. That is the most effective thing which you can do to regain back your muscles, followed by a proper diet which should be rich in protein. So what do you mean by resistance exercise? Your body has to work against a resistive force, and that can be in form of light weights or your resistance band. And I think, Reshmi, we can take up a talk even dedicated just to the exercise. But right now we are just sticking to sarcopenia. So protein diet and resistance exercise is the two best things which you can do for your muscles. And yes, it can be reversed.
Okay. To sum up this interesting conversation, what would I say? What is Dr. Tigga's tips on how to prevent and take care of sarcopenia?
So my tip starts with feeding your body. It's all about your body. So a balanced diet and the resistance exercise. One is balanced diet and the resistance exercise you have to do to reverse sarcopenia. Now coming on to the diet, protein is very, very important. So in menopausal women, we advocate 1.2 to 1.6 grams per kg per day of protein, and it should be distributed over 3 to 4 meals over the day. And what are the protein rich source? Either you can take supplement in form of a pea protein or a whey protein, whatever suits you. Otherwise, there are other smarter choices which you can make. That is, instead of taking those carbohydrates, which the simple carbohydrates, you can replace your whole grains. You can use quinoa. Quinoa is something which is like it has 8 grams of proteins per 100 grams, so that can be a very good choice. Brown rice can be a good choice. Then for other important nutrient for your muscle is your vitamin B complex. So supplements can be taken, and also green leafy vegetables, lentils, which are rich source of vitamin B, that can be advocated. Then there is essential amino acid, which is known as leucine. Leucine is the building block. It is known to have anabolic effect on the muscle. What do you mean by anabolic effect? Anabolic effect means that it builds up the muscle. So where do you find leucine? The leucine rich food sources are poultry, that is chicken, fish, and also you have spirulina, which is very rich in leucine. And as I said, that you are sitting in a very blessed belt on the globe, that is your Scandinavia, which provides the best of fish, which is rich in leucine, like tuna, you have salmon, and they are also rich in omega-3 fatty acids, which is again helpful for the muscle health. Then I would also like that all women should incorporate in their diet healthy nuts, like sunflower, you have hemp seeds, and you have also pumpkin seeds. So these are rich in omega-3 fatty acids, which act as antioxidants. And calcium is very important ion, which is required for muscle contraction. So calcium supplements are of paramount importance. Please do not skip your calcium supplementation. The recommended allowance for a menopausal woman is around 1500 milligrams per day. That is 500 milligram tablets spread throughout the day, as I talked in my last talk. Vitamin D is very important. So you need to go out into the sunshine, you need to walk. And that is how you are going to curb your sedentary lifestyle, by getting out in the sun. And the recommended daily allowance for vitamin D is 1000 international units per day, and we have supplements for that. And also I would just like to say here, just because I talked about sunshine, walking in the sun, 10,000 steps is something which is recommended for your muscle health. But I know that if you start with it may sound very alarming that how to start, it may be very daunting to start 10,000 steps in a day. So even simple things like walking 2,000 steps per day will help you regain your muscle mass. And then there is resistance exercise. That is 3 to 4 times a week. You have to do resistance exercise, and you're really good to get back your and regain your muscle health. So these are most of the tips. And also for your gut health, you can take pre and probiotics, which helps in the absorption of your healthy nutrients. So what is prebiotic and what is probiotic? Probiotic is the healthy bacteria which gives you a very healthy environment of your gut, and that is lactobacillus. And there are supplements for it, and it is also found in food like yogurt. And what is prebiotic? It's the fiber on which this bacteria thrive. So you have to take fiber rich diet like asparagus. You can have bananas, you can have onions, you can have garlic. And there are so both pre and probiotics are helpful for having a healthy gut and also taking a well balanced diet. So basically, these are my tips. Sleep is important. You have to hydrate yourself at least 8 to 10 glasses of water per day and have good sound sleep. And try to meditate, remain stress free, because stress adds on to the chronic inflammation in the body.
Amazing, amazing. That is such useful information, important information we just learned from Dr. Tigga about a very rarely discussed and talked about topic, that is sarcopenia. I'm sure audience will get inspired and would like to implement at least some of the tips given by Dr. Tigga in their daily life. That is going to help in building and retaining our muscle health and muscle mass throughout our life. So, with that, thank you so much, audience, for listening. Please go and watch other episodes if you haven't. And thank you, Dr. Tigga, for your time again.
Thank you, everyone. Have a good day.
Bye from Reshmi.